think we can get started.
Yep.
All right. Did you guys want to tell them the rules of the game on the chat and all that sort of stuff? Yeah. All right.
Sure, we can start. Welcome everybody to the Equine Seminar Series. My name is Sarah, and I will be facilitating this seminar series and this particular seminar along with my colleague, Dr. Lindsay Goodale. Feel free, the chat should be enabled, and we also have the Q&A. And thank you to everybody who sent in their questions in advance. We'll get to those as well. If you have any questions during the seminar, please feel free to reach out to Lindsay or myself.
All right, great. Well, I'll get started then. I first want to thank Sarah Basson and Lindsay Goodale for keeping up with this seminar series. It's been great fun getting in touch with our equine enthusiasts in the region and across the world. Because what we've learned from the pre-registration is that we have people potentially here tonight from all over the world and then across the United States, of course. Most are horse owners and horse professionals and enthusiasts. No horses are present unless you're sitting in the barn paying attention to this seminar. And then we have some veterinary students. So welcome everybody. We're really glad to have you here tonight. A little bit about myself. My name is Gillian Perkins, and I started riding this horse Wanda back in when I was 8 years old. And I grew up in Halifax, Nova Scotia, and had the bug for horse riding and loved riding horses and doing all kinds of different things with horses. And this was the horse that I got as a teenager in junior high. And he was with me until a few years ago. Both my children got to sit on him. So he was a wonderful kind of love of my life sort of horse that did everything with me. So he was a wonderful part of my life. He did go to vet school with me in Prince Edward Island as well. It was a great veterinary education there. Then I went on to do an internship in the University of Minnesota. And then I came to Cornell University as a large animal medicine resident. So I trained here, did my residency, became specialized in large animal medicine, and have been working at Cornell ever since. It's been a great career here. I love, horses are my true love, but we do get to work on, goats, sheep, cows, crias, all kinds of other creatures in our hospital as well. But horses are my true love, and I've been an active part of having the students involved in the student chapter of the American Association of Equine Practitioners. I have a variety of courses that I lead, and then my research has mostly been on immunology, vaccination, and equine herpes virus. But I'm not going to talk to you about that tonight. We're going to talk about some equine endocrine problems. All right, so enough about me. Let's see what we can learn about heavy horses out there. So the title is sort of like, is my horse fat? And how can I tell? And then what are the problems associated with that? So the first way to kind of think about telling if your horse is, over-conditioned or under-conditioned is what we call a body condition score. And there are many different body condition scores that you can look up online. So this is actually from the Kentucky Equine Research Group. And I should say that I may put up particular products such as feeds or this body condition score system, but I have no financial disclosures on these products. I make no money on these. I work at Cornell University, and that is my sole job and my source of income. So, so basically here we have a score that takes into account where horses have their fat deposits. And basically the horses will deposit fat in their neck, along the withers, the backbone, the flanks, the inner thighs, the tail head, behind the shoulders, the ribs. And they often talk about how the shoulder is blending into the neck. So, certainly a body condition score of 1 is a severely emaciated horse where you're seeing all their bones sticking out everywhere. You can make out their pelvis. So this is like a horse that may be a rescue horse that hasn't been eating, or maybe a horse that's very, very sick and is not using its food very well. A secondary thin horse would also be emaciated, where you're seeing most of the bones and the withers and the pelvis and all those sort of things. But what we're really going to talk about today is, when they're getting heavy, basically. So, so once we're getting to kind of like the moderately thin, we're starting to be a good body condition for a horse. So 4 and 5 are considered pretty okay for horses. So they might have a slight ridge along their back, a faint outline of their ribs. The tail head may be prominent here. So you can feel fat around it. And the points of the hip are no longer discernible. Okay. And then number 5 is sort of what we're going to be aiming for in our diets for our horses today, is sort of the back is flat, so they don't have a crease or ridge. And I'll show another example from a different angle in the horse. And fat around the tail head might be beginning, so a little bit spongy, and a little fat over the shoulders, and the neck kind of starts to blend into the shoulders and the body. And then once we're hitting the 6 to the 9, we're starting to get into our over conditioning. So they might have a crease going down their back, fat over their ribs, really hard to feel their ribs, and fat over their tails. And then once we get to even more fleshy, you see the horses getting a little more round. We start to see that their neck is getting more crusty. And then, of course, the really fat horses with the body condition score of 8 and 9, you're kind of seeing it, popping up everywhere, basically. I thought this was another nice picture from a different group showing from the back where, when we have these really thin horses with their kind of pin bones sticking out or their pelvis. And then when you're getting into these heavier horses, we have this ridge that develops in their back along their back line. So it gets more and more prominent. So this is sort of a look that we're going for from the back end of the horse. And this also shows the nice kind of circles of where kind of horses are kind of depositing the fat that we're picking up on our body condition score. So most people are going to do body condition scores to tell how heavy their horses are, and also looking at the weight tape. So you can buy weight tapes on Amazon. I did fun looking for these products for you guys. So, weight tapes are easy to find, and there's good directions online as well on how to measure the height of your horse, but then also look at the weight of the horse. And so when you're doing a weight loss program, you'll be doing, you can use your weight tape each month to kind of say, oh, we're doing well, the horse has, got a smaller circumference, and therefore it is losing weight. And it's very important to kind of be consistent about how you're positioning this weight tape around their withers and in front of their little elbows there. So weight tape is a good way to keep track of their overall body weight. It's not perfect, but it will be consistent from, month to month as you're looking at it. You can also use a scale, and here is Minnie, who is a miniature horse that lives at the Cornell University Hospital for Animals. And she's demonstrating getting her weight taken on the scale. We have 2 scales in our hospital. One is for our adult horses here, and the other that we use mostly for our smaller animals, foals and others. So here's Minnie, because she can fit on both. So Minnie is actually an individual that we have to keep track of because she's one that's also predisposed to metabolic syndrome and getting very heavy, and then potentially could get laminitis, which we'll talk about. All right, so what's the big deal if your horse is overweight? Is there a problem with this? And the answer to that question is there is a problem that horses get laminitis. And so this is the stance of a horse with a pretty significant case of laminitis. It's quite severe. You see how the horse kind of rocks back on its haunches. If I ask this horse to move, it may not want to move. And as soon as it starts to move, it rocks back on its haunches and kind of walks very gingerly on its front feet. And you can see that the feet are bandaged because they probably have some sort of frog support on there. And you can also see that for this picture, I picked a horse with metabolic syndrome or a horse that is overconditioned. So this would be a classic case of laminitis and the type of thing we're talking about today. So laminitis is very severe, very painful to horses, and is very hard to manage, and they can have multiple episodes of laminitis. So it's really something that we want to prevent happening to horses, because it can be life-threatening and something that the horse may need to be put down for. So we want to do all we can to kind of prevent them from developing laminitis. So that leads me to talking about equine metabolic syndrome, which is a disorder where the horses have a genetic predisposition to. And so these are actually what people talk about being easy keepers. So kind of like the horse that just sniffs the oats and gets heavy, the horse that you're giving, a handful of grain to and it still is fat. So horses that really seem to be easy keepers. Certainly there are situations where we are managing horses inappropriately and feeding them too much and they become heavy, but other scenarios where horses are just predisposed to be getting heavy, even though you're doing a good job with trying to prevent them from eating too much. All right, so there's genetically predisposed horses, and I'll go through the breeds in a second. They have excessive exposure to carbohydrates, and that's usually in the form of grain or grass. And they're not being exercised enough. So they're out on the pasture, just hanging out, and they have too much food around for them, and they have this problem where they develop what we call insulin resistance and laminitis. So I'll go through all of this a little bit more. So the breeds that are genetically predisposed are a pretty long list, as you can see here. We have, ponies, and certainly all breeds of ponies, but they say especially Welsh ponies. Morgans are kind of a predisposed breed. All of these horses here are predisposed breeds. So you will have challenges with keeping the weight off of these horses, and need to be very careful about offering them too much food. And when we think also about some of these different breeds here, when we have domesticated Mustangs, we often talk about the thrifty genes in these horses. So basically, Mustangs were kind of, out on the range, having to make do with what was available to them. And it wasn't always, the lush green grass of the Northeast, what have you. And so when you take those Mustangs and put them inside and they're not, really foraging everywhere, they're not exercising as much, and we're giving them a lot of grain, then they certainly have this predisposition to this problem. And I've been to some conferences where they also talk a lot about, horses in the winter, where supply of forage would be less, would lose weight. So that kind of cyclical situation where they're eating well over the summer months, and then the winter comes and they're kind of using their fat stores that they kind of gained over the summer, and then the cycle starts again in the spring. So sometimes these thrifty genes also may predispose these horses to these problems. And this is all just theory, but it seems to make some sense in my mind. So when we think also about the donkeys, they're certainly predisposed. And you can see this poor little donkey here. They've lived in countries where they haven't had too much for food. And here you go, you have a donkey on this beautiful green grass, and you have, fat deposits on the neck, along the body, everywhere. And it's unbelievable how a big shelf can really form on these donkeys. So really have to be careful with donkeys, because they certainly have that kind of thrifty gene. It doesn't take too much to keep them going. So, so we talk about this obesity and also regional adiposity, where the horse has kind of fat deposits that are a little bit abnormal, and they might actually even be kind of okay conditioned in other parts of their body. And the areas that really get targeted are the neck. So we talk about horses with these crusty necks. So if I just take my hand over the horse's neck and kind of move it back and forth, it's very thick and firm and fatty. So, and sometimes their neck, as in this diagram here, where people are kind of scoring their neck thickness, sometimes it might even be kind of flopping over onto one side. So we have their neck, the tail head will be kind of puffy and fatty. They might get fatty bumps on their, buttocks. And then if we take a look at their prepuce or their mammary gland, those will get very, very, they'll look swollen or edematous even, but it's really just fat deposit. And then sometimes they'll have kind of fatty deposits underneath their eyes, so their eyes might look kind of bulgy or even a little bit swollen. So those are kind of common areas that we see develop these fatty deposits. And what people have learned over the last few decades is that fat is not really just a storage site for energy. The fat cells, or the adipocytes, actually produce a lot of cytokines, inflammatory mediators, all kinds of different things, which can incite inflammation. So that means that the whole body ends up in this sort of like inflammatory state, which may predispose to other problems, and that the body develops more of an insulin resistance. So there's kind of these things on this side of the chart that are kind of leading towards insulin resistance. And then these other hormones, leptin and adiponectin, which actually improve insulin resistance. So there'll be an imbalance between these types of hormones. All right, so what is laminitis or founder? And it's really defined as inflammation of the lamina. Okay, so what's the lamina? It's the connection between the hoof and the bone that's inside the hoof. So here's, the horse's skeleton, beautiful long legs, and we have this, what we call the coffin bone, or P3, which is inside the hoof capsule. And he's sitting nice and parallel to the hoof capsule. So this is the only gory picture I'll show, I promise, but basically this is the horse's hoof, and they've taken a section of the hoof capsule off, and it's showing the kind of interdigitations or the sensitive lamina on the kind of bone side, and then this is the hoof capsule itself, and it shows the sensitive lamina on the hoof side. So these two things are interdigitating and connected very closely. And so when laminitis is happening, they're separating, they're inflamed, and they're starting to separate. So I have another kind of picture to help show that. But, I think sometimes it's thinking about how your fingernail is attached to your finger, and how painful that would be if you're thinking about inflammation in those areas. Another thing I also wanted to mention here is that it's not flounder, but founder. So sometimes we'll get a phone call and our horse has flounder, and you're like, okay, people mean laminitis or founder. So as a person from Nova Scotia, I've seen the flounder, but it's not what the horses have. So anyway, just wanted to tease about that. Okay, when we look at the horse's foot again, so basically this is a cross section of the horse's leg, and this is the bone that's sitting within the hoof capsule. And basically, if they take a piece here out of this hoof capsule and show the different parts there, we have the outer hoof wall, kind of the inner hoof wall, and then we have the lamina that's kind of the connection between the horse's bone and the horse's hoof wall. And so this lamina has all these beautiful little finger projections, and you can see here that they show them sort of like peeling apart off of each other. So this is where the laminitis is sort of happening, and these little finger-like projections are what are starting to kind of die off and be inflamed and separate from the rest of the hoof. And so that's why it's really painful. It's kind of a closed-in area with the hoof wall. So it really is a very painful process for the horse because it has to, stand all its weight on this part of it. I should also say that this bone here, when the part of the lamina is kind of separating, the bone will then start to move. And the way that it moves is that it rotates in this sort of direction. And we'll see that on some x-rays later. So the bone is actually shifting in the hoof capsule. And that's because this deep digital flexor tendon is running down the back of the horse's leg. And it actually is a force that's going to pull that foot backwards. So, so that means that the P3 or the coffin bone is rotating in the hoof. Other thing that can happen when the lamina separates across the entire hoof is that this whole bone won't necessarily rotate. It'll actually start to sink down and start to come through the bottom of the foot, basically. So those are the most severe cases of laminitis, is when the horse is a sinker. Laminitis is generally worse in the front limbs, but it can be affecting all 4 limbs in the horse. And horses with this kind of EMS-associated laminitis will be in all 4 limbs or just in the front limbs, and can be mild or it can be severe. So it can be all different forms of laminitis. All right, so that was a quick tour of the horse's hoof and the lamina. And really over the years, the question has been like, why do horses with this condition get laminitis? And a lot of focus is placed on an insulin toxicity. And we really didn't know this until shortly, or a short time ago. Basically, there was a study done by a group that was giving glucose to a horse IV, and they were also giving insulin to kind of keep the glucose at a normal level in the body. What ended up happening is they had to give a whole lot of insulin to the horses, and they actually all developed laminitis in this study. So it was not the purpose of the study. It was done on research horses. They didn't mean to have it happen, but it was kind of a breakthrough in our understanding that insulin itself could be toxic to the horse's foot. So insulin is a big driver, and it's going to be a big part of the management of horses with metabolic syndrome. And a diet has a lot to do with that. The other part is overall systemic inflammation. So we talked about the kind of those fat cells and the kind of inflammatory responses that are just being made by those fat cells, and those may be predisposing to the laminitis. And otherwise, we don't really know. So our focus really at this point is kind of at the insulin toxicity. There are other causes of laminitis, but the ones where laminitis just sort of develops in a horse out on a field or in a pasture, those are going to be the EMS ones, or another endocrine disorder, which is called Cushing's disease or pituitary pars intermedia dysfunction. We're not going to focus on that today. There can also be support limb laminitis. So, sometimes if we be a horse with a fracture in one leg and they're kind of got a cast on one leg, the other leg that they're standing on will develop laminitis because it's just too much stress for that limb. There's also kind of road founder, where they have concussive forces that cause the laminitis. We can have severe illness, like this horse with bad diarrhea, really bad looking gums. So severe illnesses when they're in the hospital. And then there are some toxins that cause laminitis. But the focus for today is really talking about the obese horses and the EMS. So what does it look like when my horse has laminitis? Well, it really depends on the severity. And certainly there can be mild cases that go unnoticed. And they can also be severe cases where the horse really is unable to stand or is extremely lame and has a difficult time walking, where you may really have to get after the horse to get moving, to get it to even take one step. Its feet hurt so badly. You can also take a look at a horse and sometimes see that they've had some episodes previously by seeing these kind of divergent hoof rings. And basically, they're just having abnormal growth due to the laminitis. And you see that they're kind of elongated at the heel. So there's a difference between the how close these are here versus how close the lines are when you get out to the horse's heel. All right, so you might see some evidence on their hoof. When we start to walk the horse, they often will have this short, choppy stride. The horse is walking on eggshells. Sometimes they won't move. And like that picture I showed originally, they'll rock back on their hind end when they're starting to move. And there's almost always worse when you turn them. So they kind of gimp along as you turn them. When you palpate their limbs in the early phases, their feet might be very hot. And then also we palpate for the blood vessel running down the back of the leg, which is their palmar digital artery, and we feel for what we call their digital pulses. And if their pulses are up, then that's really supportive, as well as seeing kind of these different changes in their gait. So really, if you're feeling like your horse has any of these problems, you should call your veterinarian, and they should come out and do an examination, and they'll do a full evaluation looking at the body condition score of your horse. Maybe they'll have their weight tape out to get started on kind of a way to continuously monitor your progress, and then watch the horse move. And a lot of times if they have laminitis, we won't even trot the horse. It'll just be a walk up and down the hallway and a turn. And you'll often, as you turn the horse and come back, the horse will, really see it on the turn. So often a trot is not even needed to evaluate the laminitis unless it's quite mild. Often we'll be using the hoof testers to see the sensitivity, and often to confirm the diagnosis, a nerve block of the kind of palmar digital nerve, and radiographs. So you want to document what's gone on in that hoof over the last little bit. And sometimes actually the nerve block is required for us to be able to do the radiographs as well. And then there's some blood tests to think about. So as far as blood tests, we're really looking at insulin. And insulin is a hormone that regulates glucose. So if you look at this graphic here, we see the insulin. It binds to an insulin receptor on a cell. It does some changes to things in there that makes this GLUT4 channel allow the glucose into the cell. So pretty much it's like after you eat, right, there's going to be all this glucose go into your bloodstream. Your insulin increases to tell the glucose to go into the cells and start storing it for energy for later. And so these horses that we're talking about with EMS tend to have insulin resistance. And so what that means is our insulin is going to be high, and it's not really binding to these receptors very well. The receptors aren't as they don't really accept it as well, and therefore the glucose is not going into the cells as well. Although I must say, in horses with EMS, often their glucose is normal. So we will measure the insulin, and if it's high, they're hyperinsulinemic, and we say that they're an EMS case. If it's normal, then we still haven't ruled out the disease. So they might have a false negative test, and we need to do other testing to tell. And then we do like to do resting blood glucoses to kind of compare to the insulin. And if it's high, it goes along with EMS or this other endocrine disorder, actually. But if it's normal, then it's still kind of consistent with an EMS case, because usually it's the insulin that's the problem. So normal insulin does not exclude EMS, and often we still want to do these sugar tests. And so the sugar test is really that you fast the horse overnight, so give it a flake of hay before midnight, and then that's all that the horse should have. And the vet should come out in the morning and you give some Caro syrup, and then collect blood at 60 and 90 minutes. And you're going to measure that insulin and glucose again at those 2 time points. And the horses with EMS will have this really big surge in their insulin at the time of the testing. There has been some concern that this test could induce a laminitis episode, although the endocrine group and others have not reported that happening. So even at this higher dose here, it seems to be a very, it's a good test, but also a safe test. I just want to mention this other disorder, the pituitary pars intermedia dysfunction, can also be happening at the same time as the EMS. So when you have a middle-aged to older horse that has laminitis and insulin resistance, you may need to also test for this problem. And it just is another blood test, might require 2 tests, but basically an ACTH concentration. And this is important because if your horse has both conditions going on at the same time, you do need to address this one as well. And that's a treatment using Presend or Pergolide, which is a daily treatment. So, so your vet will talk to you about that if you're in this scenario. Hopefully you're not. There are other tests looking at other hormones like leptin, which is like a satiety hormone. So meaning like it should tell you like when you're full, it should say, hey, you're full, don't eat anymore. And that's actually been linked with body mass index in horses. So a fat horse will have a high leptin usually. Adiponectin is something that's probably coming in the future. It's not available currently. And we can have in disease states problems with triglycerides, so potentially looking at those. But in most cases, people are not necessarily measuring these levels. Okay, so that's the endocrine testing for a horse with the pasture, or with EMS. And now when you're looking at a horse and you feel like they could have laminitis, we're going to take some x-rays. And there's a whole bunch of lines on here, but mostly what I want you to appreciate is that we have the left front and the right front, and this is the side-on view of the hoof or the lower leg of the horse from the fetlock down to this P3, which is sitting within the hoof capsule. And basically what you can tell is that these lines on the horse are kind of divergent. So they should be parallel. They should be completely parallel in a normal horse, and that this one is slightly more divergent than this one. And so this one has an angle of about 5.8, and this one has an angle of rotation of about 4.3. So, so this horse has laminitis, it's rotated some, and the right front is worse than the left. And we can see a little bit of gas in the laminar region in this horse, a bit of thickening between the bone and the outer hoof capsule. But these x-rays then will be used in the future when rechecks are done to assess the progress, because as the hoof wall grows out, the bone can realign over time in cases that are not severe. So, so I think that's what I wanted to say about the radiographs. They're very important and also can be used to help with the trimming of the feet. Okay, so mostly we've focused on kind of like identifying these cases, diagnosing them, and then now we're going to talk about treating them. And a lot of the treatment consists of dietary management. And really that's to limit carbohydrates and limit fats in the horse's diet, but we're really concerned about these carbohydrates and that insulin, because remember, carbohydrates are what the insulin is going to be responding to. So if your horse is not getting exercise, then really the horse does not need grain. So this is like no grain in bold letters. And really the diet should be a hay-only diet, and horses can get 1.5% to 2% of their body weight per day in hay. So what does that mean? Okay, if you have a 1,200-pound horse, then I would multiply that by 0.015 or 0.02 to come up with the number of 18 to 24 pounds. Okay, so how do you figure out how many pounds is in a flake? And actually, each flake can be very different between different hays. So I was trying to find some easy ways for people to measure the weights of the hay, and I found this at a lovely website here. But basically, this lady has found some, just laundry baskets, and a bungee cord, and then a scale. And so she's just filling her laundry basket with hay at the prescribed amount, and then storing them here to then feed to the horses. So I thought that was ingenious. There are certainly other ways you could do it. You could hang it in a hay net. You could have other ways to hang it on the scale. So weighing the hay is extremely important to know how much you're feeding them. And I will go into later that you can drop this percentage if you're trying to have the horses lose weight. You just need to do that slowly. Hay quality is important as well. And what we want to do is not have great quality hay. It sounds kind of counterintuitive, but you want a grass hay with non-structural carbohydrates of less than 10%. So again, we're trying to reduce these carbohydrates. And for you to know this, you actually need to measure it. So you need to send off to a lab that will measure these amounts and tell you that this batch of hay has this quantity of non-structural carbohydrates. And note that many labs at this point don't report NSCs. So that's really frustrating, right? Everywhere you read, you're supposed to have NSCs. But what you're then looking for is WFC plus starch. So here we have this water-soluble carbs and simple sugars and starch. And on our dry matter basis, this is all kind of around the 10% mark. So that's a good hay to be feeding for your horse. There is a lab locally here for the local people, Equi-Analytical. Here's their website. Again, I get no kickback from them, but they do provide a good service of measuring hays and their NSCs and reporting them to you. And there's great information on their website about how to do that, how to send it in, and it's economically viable. All right, so you're going to feed this hay with the 10% NSCs, and you're going to give it multiple feedings in the day, or you're also worried that your horses are going to get bored in the day and don't have much to do. So using things like a nibble net like this, so where the horse can't wolf down the hay in 5 minutes or less, that they have more time in the day that they're eating. So note, since I'm recommending that you're only feeding hay, you do need to provide a mineral supplement. And in the Northeast, we are selenium deficient, so we need to make sure that they get that mineral supplement. Otherwise, you'll start to have other problems with your horse. If you don't know the hay quality, then soaking the hay is a good way to kind of reduce the water-soluble carbohydrates so that you're getting down into that less than 10% NSCs. Otherwise, you could find a low NSC pelleted hay or Timothy balance cubes as well. So those are other options if you don't know the quality of your hay. So what about treats? Because everybody likes to give treats. And really, this is a situation where it's everything in moderation. So I have these beautiful, bunch of carrots here, but you should probably, in this instance, give a horse a piece of a carrot and not be giving lots of treats. And it seems like there's a big industry out there to sell all kinds of treats to you as a horse owner, but really trying to avoid lots of treats. So maybe just one of these little treats. And what they're doing here is comparing the amount of carbs in their treat to one medium carrot, which is then 19 of their little treats equals 1 carrot. Well, I just said we don't necessarily want to be giving lots of carrots to our horses with EMS. So just kind of one piece as you see the horse and those sort of things. So trying to avoid treats is important as well. Okay, so what about grass? Well, grass has variable sugar content, and I think people have probably written books about, when the sugar is high and low in grass, and it's very complicated. So when pastures are stressed, they may have more grass in them, so a frost or a drought. When they have dynamic growth, when their seed head fermentation. And then sometimes you and I, we just can't tell when the grasses have that higher sugar content. So the real recommendation is to avoid the grass. So how do we avoid the grass? Well, then that means no turnout on grass. And, I think that's all sad to all of us because that's what we feel horses are happy doing, is being out on grass. But I think this is where, it's sort of that killing them with kindness, we don't want them to develop the laminitis. So we'd like to, keep them off of the grass and put them onto a dirt lot. So you potentially have a natural dirt lot on your farm, or maybe you need to kind of make this up. And so here's a horse that's certainly on a dirt area and eating out of its little nibble net, right? So this is a nice example of kind of what you're looking for. You may need to fence off an area on your farm to mow the grass really short, or have other animals that have overgrazed the area, and then have, your horse out on that. So you can make your own dirt lot. You can also, often people are very concerned about the companion horse. So you have two horses, if one doesn't have EMS and one does, and you don't want the poor, non-EMS horse to suffer. So you can kind of do the paddock within a paddock kind of situation, so that the companion horse can still be kind of over the fence with the one that is, on the dirt lot. So there are ways to do this. It does take a lot of dedication to kind of sort this out. And here's another example of kind of this is a dirt lot situation in the Northeast in the winter, and a way to have the hay out so that the horses are hopefully wasting less and taking more time to eat their hay. All right, so I've really said we should avoid the grass, but if your horse is in a good body condition, so maybe you were diagnosed with EMS a while ago, you did all your work, the horse lost its weight, and now it's a controlled EMS situation where now the blood tests, the sugar tests are normal. So maybe in this situation, you can decide, okay, I'm going to start putting my horse out on grass, and I will do it for a limited amount of time. And so you can do it for 30 minutes, or you can have the horse with a grazing muzzle. But I think most people kind of say, like, you take a horse out for 15 minutes on grass, they can snarf down a whole lot in that time period, and equal to kind of a horse that's out there for a long period of time. So it still may not be good for your horse. And the grazing muzzle, you do need to keep up with that. Horses can eat right through them. You might end up with a hole in the bottom of it. They have to fit properly. They have to not come off. So there's a lot of management also associated with the grazing muzzle. So they're not perfect. I would say you'd probably still need to limit time and have a grazing muzzle to reduce how much they can get in, but they can get pretty savvy at all of it. All right, so I also have another part for the diet where we're still trying to limit carbs and we're trying to limit fats, but if the horse is exercised and has a good BCS and you're now at a good sugar test level, perhaps your horse can have some grain. And really, this is sort of very limited, right? A miniature horse that probably doesn't need much grain, all those kind of things, right? The hay is what the horse should be having and not grain. So we want the hay still at that body weight percentage and small amounts of grain. And these are just some prominent name brands that I chose to look up. So you can see that, this type is about 13%. These are running about 10% sugars. This one claims to be about less than 15%. Again, you want to give very small amounts of these if you're going to give them at all. And there's certainly other companies that have low sugar grains, but remember that, we'd probably rather just be giving the hay. All right, so in many instances, when we're first coming on board to this, we may need to have the horse lose weight. And in that case, again, we're on this 10% NSC quality hay, and then we're going to stick with the 1.5% of their body weight and give that to the horse for a month, and then reassess the weight in 30 days. And if they're not losing weight, then drop it down to a 1.2% body weight, and then down to a 1. You probably shouldn't go below 1%. And, just like anybody, the horse shouldn't dramatically lose weight. They should lose weight gradually. So, so basically working on this slowly to have the horse get down to a body condition score of like 5 out of 9. So what about exercise? Exercise is great for the horse. Even if you can just do 30 minutes 3 times a week, that's great. A lot of the challenge is actually associated with laminitis. So if the horse is really sore from laminitis, then you're not going to be able to exercise it. So then it becomes even more critical to, deal with the diet. So the exercise will help a lot with the insulin sensitivity, just as it does in people as well. And so really getting out, lunging your horse 3 times a week, going for a trail ride, moving the horse around the arena, whatever, to get them out there for a trot. So that would be helpful as well. There are medications that can be given to help manage EMS. Sometimes they're put on thyroid supplementation. Again, you should be trying the diets first, trying these other things. If you're not having an effect, then potentially giving this a try. I've certainly had situations where people have put them on the thyroid supplementation and we try to wean the horse off and they gain the weight back. So it's really best to kind of do the management and see if you can do it that way. There are other medications like metformin that can be given around the time of feeding. And these are what I would say are reserved for the really severe laminitic cases that are really hard to manage. So your veterinarian will help you with the decision to go on to what we call these other medications. And there should be more of these medications coming through the pipeline in the future as they test them in horses. So I focused on management of the diet and the EMS because I'm an internist and that's what I do mostly. But the laminitis is very real and painful to the horse if they're in an episode of it. So we need to control the pain for the horse. And often that'll be with non-steroidal anti-inflammatories like phenylbutazone. Sometimes we might need to go with higher medications. Sometimes they might need to be in hospital and really on opioids and other things. So it's a very painful condition. So resting the horse is very important, and then having them in a stall with deep bedding or even sand, because the sand really packs into the horse's hoof. When they're in an early phase of laminitis, we don't really want to kind of pull on nails on their hoof or do things that'll really hurt them. So sometimes initially we'll just use things for hoof support. So we'll use some soft rides like this, or some lily pads or other things that kind of pad a little bit more under the frog. So these will have a little bit of a wedge to them. You can't really see in this picture, but there's a little bit of a wedge. And then, of course, we always want to address the underlying cause. So if it's EMS, we want to work on their diet and other things. And then for sure, the hoof needs to be cared for and needs a lot of attention from the farrier. And it needs to be upkept very consistently. So 4 to 6 weeks, the farrier should be evaluating the horse. And what they're going to do is, like this picture shows, is they're going to trim the excessive toe so that it looks all nice like this, and allow the heel to kind of elongate and establish the normal angles in the foot. And then at some point, they may want to use frog support shoes, which may be like this is the heart bar short shoe here to help with the pressure underneath the frog. And they might even put a wedge under there as well. So certainly the veterinarian and the farrier should work very closely for managing the laminitis. It's extremely important. The farrier oftentimes will make a really big difference in how comfortable the horse is. So we're getting to the end here, and this is really my concluding slide, is that, for obese horses and equine metabolic syndrome, it really is lifetime management and treatment. So always you're going to have to, handle this horse that's genetically predisposed to this problem. And it really involves their diet and their hoof care. And you really have to be very vigilant about it and partner with your veterinarian and the farrier to give the best care to your horse. We really want to prevent the laminitis. It's very very painful and life-threatening. So it is very important to take these extra steps to prevent the laminitis. And I guess if I had a little slogan for the talk, it might be like, hay is for horses. So we really want to encourage people like hay is really the most important thing. While, you know, grain is like candy and grass is like candy too, it's a little bit the enemy for us. And so really trying to wipe out the grains and wipe out the grass that we're giving these horses. And I know that's really hard to do. So I guess with that, I'm going to end, and I think I've done pretty well. We have 8 minutes left here for some questions from the group. And thank you guys all for listening to me tonight talk about this important topic.
That was great, Dr. Perkins. Thank you. We have got a lot of great questions for you too.
Okay.
Are you ready?
Good. I'm ready.
All right. Let's start out here. Okay. For a horse who has had laminitis, an IR horse triggered by high insulin, caught early-ish, but still inflammation, digital pulse and pain, shortened, stiff gait. If there's no rotation, how long should you wait until you start riding or other exercise? Some say a full year after laminitis, but how acute? Exercise is so important for the IR horse, but it seems like a cycle will never end if you cannot start exercising before a year.
Yeah, I would agree with that. I would say that if the horse is comfortable and not on any anti-inflammatories, so if you're not treating with bute or anything like that, and the horse has been comfortable for, I don't know, I would give it a couple weeks, then I would start getting on and going for a walk and seeing how comfortable they are. I don't think I would rest them either for a year, because that goes against the kind of thought to be able to exercise them to help with the insulin resistance. So it's a fine line. I haven't seen your horse, but for sure, if you're not observing a lameness and working with your veterinarian, you should talk to them about that and see if you can get back in the saddle.
Thanks, Dr. Perkins. We have an interesting question. If someone picked up on the oral sugar test as a diagnostic, and they're kind of wondering if sugar's a problem, is that test a risk for a horse who's already laminitic, or is it mostly for borderline EMS cases?
Yeah, so if you run the insulin test and it's high just normally, so if it's like already high, so if I did that test and it was like, I don't know, our normal is like 30 to 50 or so. If you measure it and it's like 120, then you do not need to move on and do the sugar test. You're only really doing the sugar test if their baseline insulin is normal. So the equine endocrine group and others have sort of all, you know, they have these little meetings each year and they talk about their experiences with doing these testing and how much we all kind of share our information as veterinarians on different listservs. But to our knowledge, there hasn't been a case that has had an induced laminitis from the sugar test. So it does seem to be very safe. And that amount of sugar that they're getting from that Caro syrup is still a very kind of low dose. So, so hopefully, you know, we won't have the first case like in the near future, because of course it has that sort of mild potential. But for the most part, we're finding it to be a very safe test.
Thank you.
I'll go ahead and ask one that was submitted in advance, and that was, how often do you see horses that test as positive for EMS but don't show any symptoms?
Oh, okay. Yeah. So that's kind of like the horse that's got that body condition score that's like 6 or 7. And it hasn't had any laminitis yet. And certainly that can be the case. And I think I'm always talking to those owners though and being like, you know what, we really need to watch the weight of your horse. And we really need to think about like your horse is at risk for developing laminitis, and it could happen at any time. So I still am having to kind of go through these same recommendations I talked to you tonight for a horse that's got a body condition score that's, you know, 6, 7, 8. And even though it hasn't had a kind of episode of laminitis in the past, it's kind of like, you know, we're worried that it could be that walking time bomb where it happens, especially in those breeds that are on that list, right? So if it's a Morgan or a Pasofino or a Tennessee walking horse, you know, I'm really going to feel quite strongly about that recommendation to be careful with the diet.
And then we have a question from someone I know is a student, actually. She's asking whether, when you're using hoof testers, are horses that have laminitis particularly sensitive in any area of their hoof?
Yeah. So hoof testers are tricky. For mild cases, I think it's really good. And it's around the rim of the whole hoof, basically, because that, you know, the white line is kind of that area where the lamina is. So it's going to be as you're kind of going around the whole hoof. I do, when I teach veterinary students about laminitis in horses, especially when they're a really bad and severe painful case, is sometimes you'll use the hoof testers and the horses won't react. And I don't know why that is, but I have a feeling that it's because they're so painful that they really don't even care that we're pinching on them with the hoof testers. So, so the hoof testers can help you in the diagnosis, but you really still have to put the whole picture of what's going on with the horse as a veterinarian to kind of make the diagnosis.
Thank you.
Another question is, if laminitis occurs during pregnancy, is the fetus or foal at risk? In any risk?
Boy, those have been tough cases over the years when I've had a mare that's developed laminitis. And luckily, I can only say that I've seen one or two of them, so that's good. So when the horse is in so much pain and she's pregnant and we have to give all these other medications for that pain, then it actually becomes that these other things are affecting the pregnancy more than the pain and the kind of stress that has on the fetus. So, you know, I certainly don't think the fetus would develop laminitis, but there are other effects that the medications that we give to the horse that would have laminitis that can affect the fetus. And it's a lot of stress for a poor mare when she's got sore feet and a big pregnant belly. I have felt very, those have been very sad. Those have been very sad cases when I've seen them.
Definitely, yes. So I'm trying to combine, there are a lot of questions kind of in the same vein, so I'll try to combine them. So if, there's some curiosity about how do you restrict feed without causing, for example, gastric ulcers or maybe wood eating or eating their shavings? How do you balance those things?
Yeah, I think that goes down to kind of the nibble net, like the sort of feeders that force the horse to not whoop it down in 5 minutes and then be standing there bored. So just trying to kind of like have them pick out those little bits of hay from their nets in a long period of time. So yeah, I don't really have any other words of wisdom on that, but really just trying to kind of like put that flake of hay in the nibble net, come back, you know, a couple hours later. It does take them a bit to get the hay out of there. So it is good work for them and keeps them occupied for longer.
Mm-hmm. Yeah, basically the smaller the hay net you can find, the better. And then an interesting question from someone kind of asking, what's a safe goal for weight loss? So in terms of like how rapidly should you do this, presumably in partnership sometimes with your vet?
Yeah, I think definitely working with your veterinarian. I guess it is hard to give a concrete number, but certainly, you know, you should be able to kind of like assess what the initial diet is and then kind of reduce it a small percentage and then reduce it more over time. So you're looking at months to have the horse, you know, drop body condition score basically. And that's a good question.
And it looks like we're just past 7, so I think we should probably let everyone go. We couldn't get to everyone's questions, but we tried to group a few of them together. Thank you very much, everyone.
I also wanted to point out, as I put in the chat, that you will receive an email with the recording to this seminar. And Dr. Perkins and Dr. Goodale have handpicked some resources on this topic that might just answer any questions that we didn't get to. If not, if there's anything really pressing, please feel free to reach out to me and we'll help you get the information you need, or call the hospital if you need to make an appointment for your horse. And thanks everyone for joining us. It's been really great. Thank you so much, Dr. Perkins.
Yeah, thanks everybody. It's been a good night. Take care.
We will be having another seminar next month. Stay tuned in your email. You'll get the information on what that topic will be in the very near future. So have a good night. Thanks, everyone.
Thanks, everyone. Bye.